Imagine opening an old storage room, dust floating through the sunlight, the smell of old wood, silence, darkness, and somewhere in that dust may be a virus capable of killing nearly half the people who become seriously infected by it. Not Ebola, not COVID, not something from a movie. Hantavirus, a disease so deadly and so invisible that many people never even hear its name until someone suddenly ends up in intensive care, struggling to breathe. In 1993, doctors in the American Southwest became terrified by a mystery illness. Young, healthy people were collapsing. At first, it looked like flu, fever, body aches, fatigue. Then suddenly, their lungs began filling with fluid. Healthy people drowned inside their own bodies within days. The mortality rate shocked researchers, nearly 40 to 50%. And the most disturbing part? The source wasn't another sick person. It was rodents. Tiny, ordinary mice carrying a virus silently for years. No warning signs, no obvious danger, no dramatic symptoms in the animals themselves, just invisible particles hidden inside dried urine and droppings. And when disturbed, those particles could rise into the air, straight into human lungs. Today, hantavirus remains one of the deadliest viruses most people barely think about. Many hospitals don't test for it immediately. Many people mistake the symptoms for flu. And many exposures happen inside completely ordinary places: garages, cabins, attics, sheds, abandoned rooms, even inside homes. But what makes hantavirus truly terrifying isn't only how deadly it can become. It's how normal exposure feels before it's too late. And in Part 5, I'll show you the small early symptom doctors say many people ignore right before the dangerous phase begins. Because recognizing it early may genuinely save a life. How dust becomes dangerous. Most people imagine viruses spreading through coughing or sneezing. Hantavirus works differently, and that's part of what makes it so dangerous. The virus lives primarily inside certain rodents, especially deer mice. These animals often look completely harmless. Tiny, quiet, ordinary, but once infected, they can spread viral particles through urine, saliva, and feces. The frightening part is what happens after those droppings dry, because dried particles can break apart into microscopic dust, and once disturbed, they can become airborne. That means sweeping a dusty floor, opening an old cabin, cleaning a basement, or even moving old boxes in a rodent-infested area can potentially release contaminated particles into the air. You breathe them in, and the virus enters through the lungs. That's why health experts warn people never to vacuum or aggressively sweep rodent droppings, because vacuuming may blast viral particles directly into the air around you. The virus itself is shockingly quiet. No smell, no visible warning, no immediate reaction. You may inhale it and feel completely normal for days or even weeks. That delay creates danger, because by the time symptoms appear, the infection may already be spreading through the body. And unlike many viruses, infected rodents usually don't appear sick. They continue living normally while continuously contaminating the environment around them. Researchers found infected mice can shed virus for long periods of their lives, meaning a single hidden rodent infestation may quietly contaminate an entire enclosed space over time. Which means the real danger is not the mouse itself. It's the invisible contamination left behind. And once scientists understood how the virus spread, they realized hantavirus wasn't isolated to one place. It was already hiding across huge parts of the world. Different countries, different rodents, same fear. One of the biggest misconceptions about hantavirus is that it's rare everywhere. It isn't. Different versions of hantavirus exist across North America, South America, Europe, and Asia, each connected to different rodent species. In the United States, the most infamous strain became known as sin nombre virus. It spread mainly through deer mice. In Europe and parts of Asia, other strains caused something slightly different: hemorrhagic fever with renal syndrome. Instead of the lungs being destroyed first, the kidneys often became severely damaged. Some patients developed internal bleeding. Others developed kidney failure. And despite the different forms, the core problem remained terrifyingly similar. The virus attacks blood vessels. Researchers later discovered outbreaks linked to forests, farms, military training areas, abandoned buildings, poorly ventilated cabins, and rodent-infested homes. Even city environments can carry risk through rats infected with Sol virus, which means this is not only a wilderness disease, it can exist close to ordinary human life. And what makes the virus especially dangerous psychologically is how random exposure can feel. One person cleans an attic and becomes critically ill. Another person enters the same room and never gets infected at all. Scientists believe infection risk depends on viral concentration, ventilation exposure time, and immune response. But there's still uncertainty. And uncertainty creates fear. Because humans struggle psychologically with invisible threats they cannot fully predict, especially when the threat hides inside something as ordinary as dust. But the true horror of hantavirus begins after infection enters the bloodstream, because what it does inside the human body is brutal. The lungs slowly begin to drown. At first, the virus enters quietly, usually through the lungs. No dramatic reaction, no immediate collapse. But internally, the immune system begins responding aggressively, and this is where things become deadly. Hantavirus primarily attacks the lining of blood vessels. Scientists discovered the infection causes the vessels to become abnormally leaky. Fluid that should remain inside circulation begins escaping into surrounding tissue, especially the lungs. Now imagine tiny air sacs inside the lungs slowly filling with fluid. Not water from outside the body. Fluid leaking from your own bloodstream. At first, breathing feels slightly heavier, then faster, then terrifying, because oxygen can no longer move properly into the blood. The body begins starving for oxygen while the lungs continue filling. Doctors describe severe hantavirus pulmonary syndrome as resembling drowning from the inside. And deterioration can happen shockingly fast. Some patients go from mild flu-like symptoms to complete respiratory failure within hours. Blood pressure collapses. Organs begin struggling. The heart works harder and harder trying to compensate. And without aggressive intensive care, many patients die. This is why early recognition matters so much. Because once the severe lung phase fully develops, survival becomes dramatically harder. But what makes diagnosis especially difficult is how ordinary the early symptoms look. That's where many dangerous delays begin. It looks like flu, until it doesn't. The first stage of hantavirus infection is deceptive. That's the word many doctors use. Deceptive. Because initially, it may feel almost identical to a common viral illness. Fever, headache, body aches, fatigue, chills, sometimes nausea or stomach pain. Nothing immediately screams deadly virus, which is exactly why people ignore it. Some stay home thinking they simply caught flu. Others continue working. And during this stage, the virus may already be preparing for the dangerous phase. Then comes the symptom doctors fear most: shortness of breath. Not normal tiredness. Many survivors describe feeling as if their chest became heavier hour by hour. And once severe breathing problems begin, the situation can escalate incredibly fast. Emergency rooms may initially suspect pneumonia, influenza, COVID, or severe respiratory infection. Meanwhile, the lungs continue filling with fluid. One important clue doctors watch for is recent rodent exposure. Cleaning old buildings, finding droppings, sleeping in cabins, working in dusty storage areas. That history matters enormously, because many hospitals do not automatically test for hantavirus unless someone specifically suspects it. And every delay matters. The frightening reality is this: by the time many patients realize something is seriously wrong, they already need intensive care. Which raises a terrifying question. If there's no guaranteed cure, what can doctors actually do? Doctors often fight a losing battle against time. One of the hardest truths about hantavirus is that there is no universally proven cure. No magic antiviral, no guaranteed life-saving medication. Treatment is mostly supportive, meaning doctors try to keep the patient alive long enough for the immune system to survive the infection. That often requires intensive care. Ventilators, oxygen support, blood pressure medications, sometimes even ECMO machines that oxygenate blood outside the body when lungs can no longer function properly. And even with advanced medical care, mortality remains frighteningly high. That's because the virus doesn't simply infect the lungs. It triggers a chain reaction throughout the body. Fluid shifts, shock, oxygen collapse, organ stress. Everything can begin failing simultaneously. Doctors managing severe hantavirus cases often face a brutal balancing act. Too little fluid support, blood pressure crashes. Too much fluid, the lungs worsen. And because the dangerous phase can progress rapidly, timing becomes critical. Some patients survive because treatment begins early. Others arrive too late. Researchers have explored antivirals like ribavirin, but results remain mixed, which means prevention is still the strongest weapon humans currently have against this virus. And once you understand how exposure happens, the prevention methods suddenly become extremely important, because small mistakes during cleanup can become dangerous. The worst thing you can do is panic clean. Imagine finding rodent droppings in an old room. Most people react instantly. Sweep it. Vacuum it. Clean everything quickly. Ironically, that may be one of the most dangerous things possible, because aggressive sweeping or vacuuming can blast contaminated particles into the air, exactly where they become easiest to inhale. Health experts instead recommend something very different. Ventilate the area first. Open windows. Allow fresh air circulation. Then spray contaminated areas with disinfectant or bleach solution before touching anything. The goal is to keep particles wet so they do not become airborne. Gloves matter. Masks matter. Careful handling matters. Even dead rodents should never be picked up barehanded. Because the danger isn't only the animal. It's the microscopic contamination surrounding it. Rodent-proofing homes also becomes critical. Sealing holes, protecting food sources, reducing nesting areas, because prevention works best before infestation begins. And for people living in rural areas, or frequently cleaning storage spaces, awareness alone can significantly reduce risk. Most hantavirus infections happen because people never knew exposure was possible. That ignorance creates vulnerability. But there's another side to this story many people rarely think about: the psychological fear of invisible disease. And hantavirus triggers that fear deeply. Psychologists have long known humans fear invisible threats differently from visible danger. A visible predator feels understandable. An invisible airborne virus hidden inside dust feels psychologically uncontrollable. And hantavirus combines several primal human fears at once: contamination, suffocation, uncertainty, isolation, and hidden environmental danger. That's why stories about hantavirus often spread fear quickly online. Because people suddenly realize danger may exist inside ordinary places they considered safe. Cabins, garages, storage rooms, abandoned buildings, even homes. And unlike dramatic Hollywood outbreaks, hantavirus is quiet. No giant public warnings, no huge media coverage, no daily headlines. which almost makes it feel more disturbing. Because something deadly can exist in the background of ordinary life while most people barely think about it. But fear without understanding becomes panic. And panic helps nobody. The real goal is awareness, not paranoia. Most people exposed to rodent environments never develop hantavirus, but informed prevention dramatically lowers risk further. That balance matters, because once fear becomes irrational, people stop thinking clearly. And understanding the real risk scientifically is always more powerful than internet hysteria. Still, there's one final reason experts continue warning about hantavirus even decades after its discovery. The virus hasn't disappeared, not even close. The threat never actually left. Many people assume dangerous outbreaks disappear after headlines fade. Hantavirus didn't. Cases still appear every year, across multiple countries, and environmental changes may influence future risk. Scientists noticed rodent population explosions sometimes occur after unusual climate patterns. More rain can increase food supply. More food increases rodent populations. More rodents increase human exposure risk. Researchers continue monitoring how environmental shifts affect disease spread. Because viruses linked to animal reservoirs rarely disappear completely. They remain hidden in nature, waiting for opportunities. And modern human behavior may increase certain exposures. Abandoned buildings, wilderness tourism, off-grid cabins, storage units, climate-driven rodent migration, overcrowded urban environments. At the same time, many younger generations have almost no awareness of hantavirus at all, which means prevention knowledge keeps fading. That's dangerous, because awareness is often the first line of survival. Not fear. Awareness. Understanding how infection happens. Recognizing symptoms early. Knowing when to seek emergency medical help. And perhaps most importantly, understanding that invisible risks still exist in the modern world, even when society stops talking about them. Which brings us to the most important message of this entire documentary. The most dangerous threats are often the quietest. Hantavirus does not spread like a pandemic. It does not dominate headlines for years. Most people will never personally encounter it. And yet, for the people who do, the consequences can become life-changing within days. That's what makes this virus so unsettling. Its silence. A near 50% fatality rate hidden behind ordinary symptoms. An invisible airborne threat connected to environments millions of people enter every year without concern. But knowledge changes vulnerability. How the virus spreads, why dust becomes dangerous, why symptoms are often missed, what happens inside the lungs, why treatment is difficult, and how prevention dramatically reduces risk. Most importantly, you understand this is not a movie myth. It's real. And sometimes real danger looks incredibly ordinary before it becomes deadly. If you ever experience severe flu-like symptoms after rodent exposure, seek medical attention immediately. Tell doctors about the exposure, because early suspicion may save critical time. And if this documentary taught you something new, share it. Someone else may genuinely need this information one day. Subscribe to the channel for more evidence-based health documentaries explained in a cinematic, human way. Because understanding the body, understanding disease, and understanding hidden risks may someday protect your life.